Strokes kill an estimated 140,000 Americans each year, making it the third leading cause of death in women and the fifth in men. That's not all. Even people who survive a stroke are often disabled, sometimes permanently. The good news is a person who has a stroke can often avoid death and disability if they get help soon enough. Joining me now is Dr. Richard Clots, president of the Society of Neurointerventional Surgery, to talk about stroke, including the association with COVID-19. Welcome, Dr. Clots.
Welcome. Thank you.
Well, first of all, we know a stroke is when the blood supply to the brain is blocked or reduced, usually by a blood clot or a ruptured vessel. Why does every minute count when it comes to getting help right away?
Every minute counts because once the blood supply is missing to the brain, cells begin to die pretty quickly. And there's something like 1 million neurons can die every minute while the blood is not there to the brain. So every minute counts because your brain is beginning to die pretty quickly. So we have to get to the stroke and get that clot out as soon as we possibly can to restore flow. And not only to restore flow, to help get brain tissue back, but also to some death already, is to get blood flow back around and to help people recover quickly. If we do that, yes, we can help people, as you say, every minute or so means a time difference in the weeks or months to recovery. So if the sooner we get them, then they'll have less time to recover from a stroke too.
We understand your concern that during this pandemic, even more than normal, people who are having strokes are not getting the help they need. Why is that?
Well, there's several things that we think are going on. Number one, people may be fearing to call 911 and fear to go to a hospital to have, if they're having symptoms of a stroke. Just that fear alone can keep people at home and time is lost. So we're trying to get the word out is don't fear to call 911. Don't fear to call 911 because people like us, the people who do thrombectomies, we're here, we're at the hospitals, we gear up and we're ready to handle patients who have potential COVID and may be having a stroke. The other thing that we're thinking is also that families, usually before the COVID epidemic, people would be checking on each other. There'd be families going by each day, daughters would check on their mothers or grandmothers. And there's this, social matrix that people can go and check on people. And then when you're told to stay away from, people staying home, there's not that good network of people to check on each other. And if they're just doing it by phone, well, they can make a phone call once a day, and another hour later, and that patient could be having a stroke. So we're also asking people, family and friends, to check on each other. Right now you can't really go to someone's house like you used to, but check on them more, make more phone calls, check on them more frequently just to see if anything's going on.
Are you seeing an uptick in people in their 30s and 40s having strokes due to COVID-19?
There is some data out of New York and New Jersey that they are seeing young people with strokes. And what we think is happening with the COVID virus is that it is thickening people's bloods. In other words, it's thrombogenic. And there are some instances of people having clots in their lungs as well as forming clots in their brain. So there is some evidence that younger people may be affected by the COVID just because of that fact of the virus.
So how do people, regardless of their age, recognize that they might be having a stroke, and what should they do?
We have a little mnemonic. It's FAST, and the newer one is BFAST, B-E-F-A-S-T. B stands for balance, if someone's having trouble with balance that they don't usually have. Eye deviation, something wrong with their eyes. Facial anomalies, facial droop. Arm, the A is for arm, which means strength. S is for the speech, which is a really common thing, especially when people are checking on older people. They make a phone call and their grandmother is not making sense. They're not talking quite right. And then the T is for time. So do it as fast as you can. And of course, if you recognize you're starting any of these, the best thing to do is call 911. Don't fear calling 911. We're here to help, and we want people to come to the hospitals and not fear coming to the hospital.
Well, for more information, check out the webpage for the Society of Neurointerventional Surgery, snisonline.org. SNIS President Dr. Richard Klosnick, thanks so much for being here. Nice to see you, sir.
Well, thank you. Thank you very much.